My name's Adrienne, and we're going to be discussing narcotics today for our pharmacology class. And I'm Adrienne, and then I also have Zolma with me here today. And we're going to do a little skit, kind of a hospital setting type thing to describe narcotics and to give everybody a better understanding of what they are. Narcotics, also known as opioids. Uh, some of the common narcotics are Percocet, Vicodin, Norco, oxycodone, and morphine. When I think of like a numeric, I would say more of a picture to help me remind me of these. I would think of a poppy flower. Um, Opioids actually originate from the poppy plant is how they make narcotics. If I were today, we are going to use Percocet as an example of our narcotic. Percocet is actually a mixture between an opioid and a acetaminophen. So like it's more like an opioid and a Tylenol. So we're going to be discussing with our patient the precautions to use with that, make sure that she's not buying over-the-counter Tylenol to add to that, and to make sure that she doesn't go over the amount, which could cause liver damage, things like that. Some of the common side effects with most all narcotics. Narcotics are a Schedule II drug, which is very important for me to mention. As far as using opioids during pregnancy, as long as the benefits outweigh the risks, basically, they do give it. There hasn't really been any true known, except for if the mother is overusing the narcotic, the baby could become addicted to the narcotic. So there would have to be precautions to take if that were to happen. Typically, they will give the mother things like methadone, things like Suboxone, different meds that can kind of help her taper off slowly during pregnancy. But this is only for extreme cases. But it is something to look out for, and then that can cause, major problems with the unborn child and even after. Some side effects of most narcotics are constipation, nausea, which a lot of the times the doctor will prescribe like a Zofran or a Phenergan, something that will help with nausea. You also do want to listen to bowel sounds of your patient, make sure that there's no constipation, and if there is, maybe talk to the doctor about getting something to help that. And also educating your patient about the importance of eating fiber and foods with grains in them and things that will help give the patient fiber. Always make sure you ask your patient when their last bowel movement was before administering this type of meds so you can get a better idea. This can be passed on through breast milk and make the baby kind of groggy, but we still do encourage moms that are receiving opioids or narcotics to breastfeed. We haven't really seen too much harm from this. We still encourage mom to breastfeed. There's different types of narcotics. Some of these can be intravenous. Some of these can be like IV drips, like of morphine for major surgery. So these can be administered that way, and they can also be administered in pill form. And it's very important to educate your patient about the fact that these meds can be highly addictive and to seek help if that seems to be a problem, and of course to only take the narcotic prescribed is the way it says, because it can cause respiratory distress, and you want to assess for any history of breathing problems or a heart that's just a slow heart, because that can indicate what happens is these meds really slow you down. So you really want to assess that. And again, these can be addictive and cause liver damage. And thank you.